Hello, this is Dr. David Pomeroy, your host of the podcast ADHD Focus. I'm very glad to have to me a special guest today. Cynthia Hammer is the founder of the Inattentive ADHD Coalition. The website is iadhd.org. It is the second nonprofit about ADHD, which Cynthia has founded and started. She founded AD Resources back in the mid-1990s, educating people about ADHD. After her diagnosis, that was very hard to get information about it. I had the pleasure of being involved with AD Resources for a number of years, and now glad to reconnect with Cynthia in her new venture. We've decided to look at the girls and ADHD, both inattentive and the combined type. But first, we wanted to talk about the confusion in terms of the official diagnostic label of ADHD, separated into primarily inattentive and combined, that perpetuates the myth in many people's minds that, oh, you have to have the hyperactivity to have the disorder. Have you found that to be true?
I think hyperactivity means we all have hyperactive minds. That is very esoteric. It's not how most people think of hyperactivity. They think it means you have a physically hyperactive body. Those of us with the inattentive type of ADHD do not have the physically hyperactive body. It's so much in the public knowledge of this image that it's someone that's physically hyperactive and disruptive in the classroom. To try to move that image to a wider frame of reference so that it includes these other people, boys as well as girls, who are not physically hyperactive, it's a hard thing to do, especially when the name continues to include that word. A lot of people dislike the name ADHD. The reason I've come to dislike it is because it has that word hyperactivity in there. It totally negates those of us with the condition who don't present with that aspect of it.
Exactly. The diagnosis is ADHD, definitely confusing.
In a way, it doesn't really matter. The medicines are the same, whichever type presentation you have. Dr. Dodson says maybe the inattentive type needs a little smaller dose. The problem is in the image it creates. It contributes to the underdiagnosed of those that have inattentive ADHD. The predominance of the ones that aren't getting diagnosed are those with the inattentive ADHD or females who were hyperactive, but they suppressed it because the culture gives them a strong message that we don't like girls that are too wild, too energetic, too active. And so they work to suppress it.
Child can do fine in elementary school. They have one teacher and there's established, here's when you do the homework, and the teacher reminds you. They get to middle school, they have 5 teachers. They have different times assignments are due, and their inability to plan and organize shows up. It's when the life situation overwhelms the executive functions.
I don't think it shows up. It's a condition you're born with, and the problem is people aren't recognizing it early enough. They say by age 12 because that's when they're starting to see it. If they knew what to look for, they could recognize it earlier. Dr. Orrin Mason told me he felt comfortable diagnosing children by the age of 7.
Well, doing it, but there are still children that it's not so obvious. Maybe it's there if people knew what to look for, but then there are these myths. Oh, well, you're doing fine. You have good grades. You're behaved. The teacher wouldn't know you're daydreaming because you're not causing the problems of the disruptive kids that draw that teacher's attention.
But what we're hearing from people is that delayed diagnosis has negative impacts.
Well,
and so we shouldn't accept it. We shouldn't say, oh, it's okay to diagnose by age 12 because you've already had a child living 5 or
Yep.
6 years of their life thinking they're different, thinking they don't fit in, thinking I
Yes,
have
I
to
agree.
try hard to be
I'm not
acceptable.
I'm not saying that we ignore it or wait until age 12. I'm just thinking things that bring out the symptoms are not always evident by age 7. Some are, but parents are the executive function of children who are 5, 6, and 7. It's not expected that the child is going to know when the math packet is due, have it in their backpack, and remember to turn it in. A child that gets the homework done and doesn't turn it in is a big red flag that ADHD may be there. But I don't think a child is expected to remember that until later grades.
My feeling is that there's a bell-shaped curve to children's behavior in the classroom. The teacher could pick out the children who are on the tail end of the bell curve.
But teachers aren't trained how to. In a recent survey, the teachers, I think 40 or 50% said, I don't know anything about ADHD. That's a shortcoming of the training of teachers trying to distinguish learning disorders, ADHD, particularly with the impact it has. Why isn't that part of the basic education the teacher gets?
There's this growing awareness of neurodivergence. Maybe 20% of the population have neurodivergent conditions like ADHD, autism, Tourette's, OCD. We find it challenging to fit into the neuronormal expectations.
Okay.
There's this whole wave coming now of creating inclusive design. Just like we've learned with handicap, we build ramps, we build elevators, we incorporate people to interpret for the deaf. We've learned how to expand what we offer so it's more inclusive. There's a group of us who haven't felt included. If you make some simple adjustments, we're going to feel more welcomed and less stigmatized. We're not where we can point out children that have neurodivergence, but it's coming. We need them to learn earlier because that is when they're going to
Yes.
start thriving. We can't accept adults
Right.
getting diagnosed in their 50s and regretting their life. We need to identify these children early. By 7 years old, that is when they're starting their school history. Some of them are very intelligent and get by, but they still suffered.
Oh, yeah. There's going to be a lag time. There weren't even the diagnostic criteria until 93 that started to say, oh, this attention hyperactivity is real. Before that, it was minimal brain dysfunction. Most psychiatrists, much less primary care docs,
Right.
that doesn't percolate down for a long time. Doctors have the same misconceptions as everyone else. It doesn't exist. You aren't hyperactive. You've got good grades. It couldn't be ADD. So it is going to take a lag time. But I 100% agree with you that neurodivergence needs to be recognized, and even learning disorders. Dyslexia is the way your brain processes things. That's divergence from the neurotypical.
ADHD is highly genetic. If we increase the number of children that get diagnosed, and we say, as soon as a child gets diagnosed, we recommend screening to the parents, that is going to help.
Right.
I
agree.
interviewed 25 women. Some of them found out after their child got diagnosed. Some of them, thankfully, found out during COVID because they watched TikTok and Instagram. It gets criticized, but good for them because at least out of
Yep.
25 women, a third of them said they only learned because of something they saw on TikTok or Instagram. I don't know if you agree with this, but only 20% of adults have been diagnosed with ADHD. I think it's the more intelligent ones because they say, why aren't I performing better? I know I'm smart. Why am I continuing to have problems in life? Or they're the ones that have the money to get the diagnosis. When people with ADD are really bright, we're looking at a skewed sample. We're not
People
talking
do.
about the ones that are in jail, the ones that are struggling in
Yeah.
life, the ones that are on. We have a skewed image of what ADHD is like when we only look at adults who have been diagnosed.
In my experience, ones who are intelligent aren't the only ones who get diagnosed. They may be diagnosed because they've had a problem at work, they've been written up. It's not their intelligence that leads them to seek diagnosis.
Someone else was
Yes,
alerting them
someone
to
else
it.
sees it, or their spouse says, you've had all these different jobs. And many people, it's my child got diagnosed, so I wanted to look at it. They're not people that have an IQ of 120 or higher. But 4% of adults have ADHD. If the population of the US is somewhere around 50 million, that's many people that have ADHD, but it's not recognized. A recent survey that done figured that 60 to 70% of people in prisons have ADHD. That's not unusual with impulsive behavior, all kinds of substance abuse, addictions, a
Yeah,
way
when
to
you think
escape.
something's a good idea and later you realize it wasn't a good idea.
Yeah. Oh, the keys are in that car. Let's see how a Ferrari is driving, or speeding tickets and then causing danger, or having guns and getting upset with someone, or just beating the heck
Right.
out of someone with
Yeah. Dr.
fists or
Hallowell
anything
used to
else.
talk if you have AD, you shouldn't have sharp knives in your family. I thought, boy, that's extreme. But
Yeah.
if you have that impulsivity,
Yes. Yeah. The impulsivity. I worry about some kids when they're 12, 13, 14, and they're not just pushing someone, but they're beating up someone, or they're really insulting someone. You get to be 18, 19, you're an adult and you're going to be held responsible for smashing someone's car to pieces or beating
yes,
them up. It's very difficult. It has been underdiagnosed. I see this in so many kids. One fellow about 8 or 9 was so frustrated during a test that he threw his pencil on the floor. The teacher perceived that to be early violent behavior, empty the classroom because he was violent. Let's have a behavior plan
oh my
because
gosh.
of this
Oh,
violent kid.
oh,
He's not trying to hurt anybody. He was upset that he couldn't do that test. It's not because they're a violent person. They are acting out. They're frustrated
yeah,
or they're
yeah,
angry. But an 8-year-old can't express that in words. I'm angry because I couldn't catch up on the test.
yeah,
They're going to
yeah.
show it.
I assume that you've had young children where the family refuses to medicate them. Can you talk
Mhm.
about the path that puts the child on, or what happens?
Yeah. I'm thinking of one woman who's now, I think, 52. I've seen her for about 4 years. She said she was diagnosed quite early. Her mother said, no child of mine is going to be put on addicting medicines. My view on that is amphetamines are addicting to people who don't have ADHD. Someone who's taking it as prescribed, diagnosed with ADHD, if they take more than what helps them, it doesn't feel good. There's no incentive to keep taking, or they don't get a euphoria. They have a headache or their heart's going 150 beats a minute and it's uncomfortable. So they cut back down to the amount that works for their focus.
I'm
I
not
think in
talking
my
about the addiction.
practice,
I'm talking about how it helps the child or not helps the
yes,
child to be on
yes.
medication.
Part of the reason a child doesn't get on it is parents
Have
can
a
have
myth. They
those medications are terrible. They aren't, when they're used appropriately, prescribed to someone who actually has ADHD. This person I diagnosed when she was about 48, and a really small amount, 10 milligrams of an Adderall tablet twice a day. She said, it's changed my life.
Mm.
I was able to go from working for an organization as a social worker